wonderful nurses. I'm super excited to have you here today. If you are a nurse and you're preparing for your Osce exam, do me a favor, just grab a seat, grab a popcorn, and listen attentively to everything I'm going to be telling you in this video. You know I always say this, nurses are brilliant and Osce is simple. And that's our slogan. You must pass your Osce exam in first attempt. But I must tell you, there are a lot of errors some of us are making, and which is making us to go and take the exam again. I know when we take the exam again, we call it a receipt, but they don't see it as a receipt. They see it as they are trying to make you safe to practice. You must be safe to practice. And in today's video, I'm going to be discussing everything you need to do to enable you get that exam in one sitting by the grace of God. If you are interested, stay tuned.
Ryan Little.
Alright, beautiful people, and welcome to my channel. You're writing your Osce exam soon, right? You have passed. Trust me, with God on your side, you have passed. Now, let's take it one at a time. First thing first, you know, if you are doing any station in your Osce exam, whether you're doing assessment or you are doing ski, and by the way, let me tell you how the Osce exam works. You can start your Osce exam with assessment or you can start with skills. It depends entirely on your assessor. It depends entirely on your assessor. Now, let's assume you are starting with skills. If your assessor does not say Violet, assume all checks have been done. You must start by saying, I check for scene safety, I provide privacy. As little as that is, if you don't check for scene safety and you don't provide privacy, when your assessor did not say, assume all checks have been done, that exam is gone. You have to go and resit it. That's not your portion. That's what I'm telling you. I have seen results like that, and that's why I'm here to tell you all the things that you shouldn't do, because if you make those errors, that exam is gone. That's why. Now, secondly, whether you're doing assessment or you are doing skills, you must make sure that you are gaining consent. By the way, I like to appreciate all of you who have sent me gifts. A lot of people have been sending me gifts these days, special gifts. Thank you. I passed my Osce exam. Thank you so much. God bless you all. Now, secondly, you must gain consent. What do I mean by gaining consent? My name is Violet. Can you please tell me your full name, date of birth, while I double check with your wristband? You do. All right, I have the right patient. I see you have a white wristband on. You don't have any allergy, right? Yes, no, I don't have any allergy. Beautiful. I'm here to carry out an assessment on you, or I'm here to give you your inhaled medication, or I'm here to teach you how to use the peak flow meter, or I'm here to administer your 18 o'clock medication. Is this a convenient time? You must gain consent. We've seen results where it's mentioned that candidates did not gain consent. You must gain consent at all times. If you don't gain consent, it's sad to say, you have to come back, but that's not your portion. And of course, that's why I'm doing this video, to let you know that you must gain consent. Now, having said that, when you have gained consent, you prepare all your equipment. Guys, I'm not joking. Skills assessment, a lot of people are forgetting to validate the equipment. It's not enough for you to pick this and say, this is my medication, assessor is valid. That's a fail. No, they don't want it valid. This is my medication. The expiry date is 5th of July 2024. You must read out the expiry dates. You must. If you don't do it, they say, oh, she's not safe to practice. She has to come back and prove to us that she is safe to practice. That's not your portion. And again, that's why I'm doing this video. All right. So make sure you are reading the exact expiry date on it so that you are passing. Guys, I must tell you, lots of my students pass in first attempt. So you too, you can do it. All right. And that's why I'm doing this video. Now, having said that, you must read the expiry date and confirm the validity. Now, let's go to the A to E assessment. For your airway, let's assume you finish the patient observation. You must tell the patient their new score. You must tell the patient their GCS score. You must tell the patient their PHQ-9 score. You must tell the patient their Alzheimer's disease score, whichever you are. For instance, you have a news total of 2. I'll monitor you 4 to 6 hourly and I will escalate your care. Some students don't say it. They just do the news total. They don't tell the patient at all. They just jump to e-assessment. No, you must tell the patient their news total. Some people finish the PHQ-9 and they say, I'm done with your PHQ-9, can I do your observations now? You must tell them their PHQ-9 score. Hello, Mrs. Haley, you are having your PHQ-9 score 14. For a PHQ-9 score 14, it means you have minor depression. The treatment recommendation on my chart here is antidepressant, psychotherapy, and watchful, blah, blah, blah. You know what I mean? You must verbalize to them. You are having a GCS of 14/15. I'll continue to monitor you every 30 minutes according to NICE policy. You are having a 6 CIT score of 17, meaning you have what we call significant cognitive impairment. I'll refer you to the mental health team, psychiatry team, and the neurological team. You must tell them, okay? Now, when you finish telling them, you go through the A2E assessment. If your patient does not call for airway, that's a fail in your Osce exam. We have been communicating, your airway is clear. Can you call for me? So it's either you ask the patient to cough for you or you ask the patient to take a deep breathing breath. By the way, I've been seeing some of your emails. Some of you are like, Nosvi, you've abandoned us. No, I didn't abandon you guys. I just felt all my videos are still relevant. But so let me know in the comment section what video you are looking up to, because a lot of people will say, Nosvi, I didn't find your video on this. It's there. So just type any station or skill you want and type Violet. It's going to bring out all the videos I have on that station. So I have videos on all the station. I have videos on all the station. Okay, all right. Now, except of course ANTT, I don't have a video yet on ANTT. I don't have a video yet on, I think, oxygen therapy. I did have a video on oxygen therapy. I had to bring it down because I was made to bring it down. Now, finally, for breathing, we know that when we talk about breathing, we're talking about the respiration and the saturation, and this is how it works. I did your respiration for complete 1 minute. Always look at your news chart when you are talking. If you tell the patient, I did your respiration for 1 minute, your respiration is within the normal range, no stridor, no use of accessory muscles. When the patient's respiration is high, if the patient's respiration is high, I did your respiration for 1 minute, your respiration is high. So when the respiration is high, there is stridor, and that's how somebody had to go and resit her exam, because she was saying there's no stridor, there's no coughing, and the patient was having a respiration of 25. And I said to her, you must look at your news chart whenever you are talking. So I did your respiration for 1 minute. Looking at my news chart here, you may not remember the value. Looking at my news chart here, your respiration is normal. There is no stridor, there's no cough, there's no wheezing, no use of accessory muscles, no visual sign of respiratory distress, no unequal entry of air, no respiratory noises, no seesaw breathing, no coughing. I'm very happy with that. You must mention 4 parameters. So for you to pass breathing, you must measure 4 parameters, so at least minimum, while you feel the respiration is okay. And I did your saturation as well. Your saturation is within the normal range. Now I move over to circulation. Circulation, you are talking about the blood pressure, the pulse, and the capillary refill. I did your blood pressure. Looking at my news chart here, your blood pressure is okay. I'm very happy with that. I did your pulse. Looking at my news chart here, the strength of your pulse, the rhythm of your pulse, the rhyme of your pulse is okay. I'm happy with that. I checked your nail beds. You were properly perfused and there's no cyanosis. And I've said it severally. Usually all patients in Osce exam are properly perfused. There's no cyanosis. Now I move over to disability. For disability, you must be talking about 4 things. Do you know where you are? Are you having any pain? Has anybody checked your blood sugar? Can I know your urine output? And I always add, are you eating and drinking okay? And you must mention them. If you don't mention them, everything in disability, they feel that you're not safe to practice and they will let you write the exam again. But again, that's not your portion. That's why I'm doing this video. If you want me to talk about anything at all, drop it in the comment section and I'm more than happy. I'm always at your service. I'm more than happy. I want to say this. If you have a receipt and you don't understand the reason for that receipt, all you need to do is to book a class. If you have Osce tutors who trained you for that Osce exam, go to them, let them explain to you the reason if you don't understand. And of course, if you are a self-sponsorship, book a class and we'll talk about it. The reason I'm saying this is because I had somebody yesterday, that's why I'm doing this video, and she sent me her results. She said she failed. I said, oh, okay, bless you, I'm more than happy to help you. And obviously she has taken the exam 3 times, and I said we can't help you because for the Osce exam you have to take it once, you have to take it second, you have to take it 3rd time, and once you've taken it 3 times and you don't get a pass in all the 10 stations, your portal will have to be closed for 6 months. So your best bet is, if you don't understand your results, be very free. Just book a class and you discuss your result instead of going to fail 3 times and letting your portal get closed. Do you understand? I don't think you really need much class because the exam is so simple, and I give all my all in videos. I give all my totality in videos, and that's why I always get lots of passes. Okay, but if you still feel you need further help, always feel free to book a class. Okay, now having said that, for exposure, I did your temperature. Your temperature is within the normal range. I'm happy with that. You have rash, bruises, swelling in any part of your body, and the patient says no. Now there are questions you must ask. like drug compliance. Looking at your past medical history, you have a past medical history of osteoarthritis, you have a past medical history of this. Do you comply with your medications? And let the patient say, and you know what to say. The second question should be, do you have any concerns for me? And if you are dealing with end of life, always ask them about spiritual leaders. Do you want me to invite any of your spiritual leaders to come have a word of prayer with you? Apparently, I don't want this video to be very long. I think we'll continue when I hear from you. Tell me what you want me to talk about, because I think I've done literally all. I've done a video on oral care. I think I've not posted it yet. I'll try and post it when I post this one. Literally, I have videos on all of them. And of course, you can become a channel member. If you're a channel member, you become accessible to some of my videos that are not accessible to everybody. All right, thank you so much for watching. I'll see you in another juicy video. Until I see you again, make sure you keep passing your Osce exam. God bless you. Have a blissful week.